So, you think you know Blackpool?
On the one hand, I think they think about tourist attractions like the Blackpool Tower, the beaches, but on the other hand, I think they also think about high suicide rates and low life expectancy, maybe drug and alcohol misuse.
What I want people to know about Blackpool is that we're all sort of like a tight-knit community, and we want to really make sure that everyone in the town can have the best quality of life they can. So whilst there are the issues that Caitlin raised about suicide rates and drug and alcohol misuse, low healthy life expectancy as well, there's people in the town who really care, and there's young people in the town who really want to make a difference and really want to get involved in health research and helping to reduce health inequalities, and that's what's really driving all the young people who are involved in this kind of work.
So we've got significant health challenges, starting with poor life expectancy, poor healthy life expectancy, and there's lots of things that make up those statistics. We have high levels of deprivation, which of course affect the long-term health of the population, and along with that, drugs, alcohol, cardiovascular disease, respiratory disease, high levels of smoking and obesity all contribute towards our lower life expectancy. We can use the Levelling Up agenda to address some of the key fundamental socio-economic issues. So, for instance, housing. Housing is a significant public health issue here in Blackpool, as is deprivation and low wages and low levels of educational attainment. The ambition here is that we use research and evaluation to incorporate into everything we're doing on a daily basis. So we have access to the populations through the programs that we deliver on the ground. What we don't have easy access to is the research and academic expertise, and having that sat alongside the projects that we're delivering on the ground, it's marrying up that academic expertise and the projects on the ground, and bringing those two together could be really, really powerful.
HDRC will focus on 4 areas that are a priority for Blackpool: housing, the first 1001 days of life, education, employment and skills, and mental health. Vicky Piper is Housing Manager at Blackpool Council.
So these are really exciting times for Blackpool. The potential with the Levelling Up pilot gives us everything we've been asking for a number of years based on the evidence that we already have. There's also an opportunity here to be the first place in the country to trial some of these new regulations and the new legislation, and we can't sort of underestimate how important that might be, and also how important it is for us to really understand what we're achieving and be able to measure that in a tangible way. The work that we will do in Blackpool may well inform national policy and national legislation as that rolls out across the country, and so it's incredibly important that from day one we have a really strong monitoring and evaluation aspect to this project.
In Blackpool we have a really vibrant and proactive voluntary sector, and working in partnership and collaborating is part of what we do and we want to do more of. And the sector are really behind this bid because it's very much about being able to provide that evidence for the work that we do and work in partnership with academic organisations and the local authority to really provide evidence for making decisions about where we put funding and how we use that to improve the health of our communities. Working across the network of integrated care systems is something that, again, is really important to us as a voluntary sector. There's a lot of work happening at the moment at a national level to ensure that the voluntary sector is really embedded within the new health and care structures. And I think that in itself as a network will really give us opportunities to duplicate some of this work in other areas and share the learning. But also across the voluntary sector, there's so many various different networks. We have a Northwest network of voluntary sector leaders. There's also networks within organisations, so Citizens Advice have a very strong network across the country. And all of this work that we're doing can feed into those networks, help inform the way other people do things in other areas, but also give us an opportunity to really showcase what we're doing in Blackpool.
At Lancaster University, we are really excited to be building upon our partnership with Blackpool Council. As a civic university, we pride ourselves on our interdisciplinary research with the local community that makes a real difference. Take the challenge of sustainable and affordable homes for all. We can draw on researchers from public health, social science, environmental sustainability, economics, architecture, and design. But this is not about us coming in with the research ideas we want to pursue as academics. It's a coming together as equal partners with the Council, NHS, Third Sector and the people of Blackpool to ensure that the solutions that are co-created have a robust theoretical and methodological basis and can provide an evidence base for real change to improve people's lives. We can provide Masters and PhD students training opportunities and also facilities such as our new Health Innovation Campus to support this work.
Yeah, it's just how it all works together now. 'Cause I just remember sitting in my first strategic board at Fulfilling Lives when I was given this job role, and I remember saying to my boss, Mike, I really need your support in this role, otherwise I'm not going to be able to do it because we're going to come up with a lot of conflict. And I think from that first meeting where it was, why do we need lived experience? We've got volunteers, we're like, no, we want strategic change. We want things to look differently. So I think from seeing it go from there to me seeing them as my colleagues now, really. So I go into a board meeting now and it's just a meeting with my colleagues.
Producing evidence, you know, to show that stuff works is really important. We need evidence, and I guess, you know, going further up the chain, to be given money, you have to start producing evidence, and I think some of the most important ones for me is, instead of writing KPIs and tick box stuff, I like real stories, me. So how have you helped this guy? This guy was homeless, just got out of prison. He was a prolific drug user. He's just got out of prison today. Here he is 4 months later. How have you helped him? And I can answer you them with many. I've just got one who's just got out of prison.
At Blackpool Council, we are passionate about addressing the health inequalities impacting our people and communities. Despite our best efforts, they continue to worsen, and we have to do things differently moving forward. As leader of the council, I will take full responsibility to ensure the engagement and involvement of senior officers and elected members. Through our leadership board and scrutiny arrangement, this project will benefit from all the expertise that both elected members and senior officers can offer. As an example of this, regular reports will be considered at the corporate leadership team meetings led by Chief Executive Neil Jack. This will provide robust accountability to the NIHR for the project, both financially and importantly for the outcomes we achieve. Elected members will work alongside CLT via the leadership board to add another critical layer of accountability and governance. I'm personally involved in networks with other local authorities and wider partners, but crucially I want our communities to know and be actively involved in what we are doing.
We know our town, and we know that if we get this opportunity to work alongside researchers as equals and learn from each other, we can and will make our town a healthier and happier town to grow up and live in. Wouldn't that be something to be proud of?